Thank you, Huda. In my 7 minutes, I'm going to try to give you both an experiential sense of what it might be like to struggle with a problem like depression, and to talk a little bit about the paths that people go through in terms of getting treatment and what the common treatments are for depression. And then I'm going to finish up by talking about a new direction in terms of antidepressant treatment that's offering some hope, and actually finish with a clinical vignette.
Can you turn on your mic?
I turn on my mic. Is that better? Well, I'm going to pretend that you heard what I just said and launch right into my presentation. So what is depression? We have to begin, unlike autism, where it might be very hard to imagine what it might be like to experience autism. With depression, we realize that everybody has experienced frustration, anxiety, disappointment, sadness, loss, so that the symptoms we're often talking about are symptoms that have some connection to the experiences that people have in their everyday lives. But imagine that every day was the worst day of your life. You were in such despair, maybe you couldn't get out of bed. You were so terrified that you couldn't leave your house. You had no energy. You couldn't get things done. And imagine that you were so wrapped up in your thoughts that you just reviewed the same kind of negative thoughts over and over. You're consumed by negative ruminations. You probably wouldn't be able to take care of yourself. You couldn't sleep. You couldn't eat. You couldn't imagine doing anything. You couldn't imagine that anything would be fun or worthwhile doing. And so you couldn't function. Imagine that you couldn't think clearly enough to make simple decisions. You couldn't choose one thing or another. And then you found yourself either wrapped by apathy or wrapped up in despair. So obviously I'm talking about a wide range of experiences that patients will experience with varying degrees. And because there's so many different kinds of experiences, different patients may have different profiles, so there's some heterogeneity to the experience that these people have. So what might you do? You might lose your job, your marriage might fall apart, you might become distant from your friendships. You might start drinking alcohol or smoking heavily, using cannabis to sleep, or even trying other drugs. You might even cut yourself, because you're so numb and apathetic that if you just felt something, it would feel better, even if that something was pain. And of course, too many people with severe depression or mood or anxiety disorders will take their own lives. What are the medical consequences? So if you have depression, you have an increase for cardiac disease, cancer, stroke, diabetes, and if you have any of those conditions and you are depressed, you're more likely to have a bad clinical outcome and you're more likely to die. Depression shortens your productive lifespan by about 13 years, and it shortens your life on average by 5 years. So how did you get there? And this is obviously building on many of the themes that we talked about this morning. Maybe you had risk factors. Maybe people in your family had a history of depression or severe anxiety problems. Obviously genetic reasons, and we'll hear more about that. Maybe you suffered early life neglect or early childhood trauma. Maybe you had a history of substance abuse or alcohol abuse during adolescence that increased your risk for developing symptoms of anxiety or depression. Maybe you are under stress now. Maybe you've had a lot of chronic stress at work or in your family. Maybe you've had some major life event that's disrupted your social relationships, a loss, a divorce, or maybe you lost your job. Or maybe you've seen something really terrible, or maybe you yourself came near to being killed and developed a trauma. Or maybe you had a medical illness. Depression risk goes up with a variety of medical illnesses. Maybe you're treated with medications that increase inflammation. So what did you do to try to get better? There are many forms of treatment for mood anxiety disorders. Some of these target behavior or thought processes such as psychotherapy, and there are many effective forms of psychotherapy. Maybe you sought treatment that was directly manipulating the activity of a circuit, as might be the case with transcranial magnetic stimulation or transcranial direct current stimulation, which is a more research procedure at this point, electric convulsive therapy, or even deep brain stimulation. Or we might manipulate these circuits through molecules, particularly antidepressant medications. Consistent with what you heard from Huda, depression treatments are not specific to depression. The psychotherapies work for mood and anxiety problems, the medications, etc. That applies to it's not specific to diagnoses, they're not yet specific to subtypes, and they're not specific yet very clearly, although there are some differences around the treatment of depression in adolescents and children versus adults. Antidepressants. 1 in 8 Americans has had a recent prescription of an antidepressant medication, which is an enormous frequency. The medications that are prescribed predominantly to treat depression target the modulatory signaling mechanisms identified by Professor Bargman this morning. In other words, serotonin, for example, norepinephrine, the monoamines. The treatment overall response once you fiddle around with many different medications over long periods of time, we can generally get about 70% of people with depression to have a remission of their depression. So the outcomes overall are much better than they would be for, say, the treatment of schizophrenia. But the medications are very slow acting. Even the people who respond usually don't respond fully for at least 2 months. The responses are very heterogeneous. Only 1 in 3 people will respond to their initial antidepressants. They're also heterogeneous in that about 1 in 4 people treated with an antidepressant, at least based on duloxetine and fluoxetine, are actually better off treated on placebo than they would have been treated on the medication. And 1 out of 3 patients who achieve a remission will relapse in the subsequent 6 months. So getting people better and keeping people better remains a substantial challenge for people with depression, and the result is the huge public health impact that you heard about. New treatments, though, are often offering some new hope. Our group in the late 90s, mid to late 90s, reported that a single dose of an NMDA glutamate receptor antagonist called ketamine was getting people better into this state of transient improvement or recovery within 24 hours of their first dose. Overall, as a treatment, in these treatment-resistant populations, the response are relatively robust, with as many as 50 to 75% of patients responding in the clinical trials so far. These doses can be repeated as a treatment, and there are even centers around the country that are using this as a treatment, and it's in development. The point that's interesting about this novel treatment is that it highlights a theme I think that will be recapitulated in this presentations. Treatments targeted at circuits. What's novel about ketamine is instead of targeting the modulatory inputs, like serotonin, it's actually targeting the intrinsic circuitry of the cortex and limbic system, in other words, glutamate. That there are some points of circuit conversions between the brain stimulation treatments and the pharmacologic treatments. That we're understanding treatment response or treatment efficacy in terms of structural change in the brain, like synaptic proliferation, novel signaling mechanisms, as I mentioned, glutamate synaptic function, and other mechanisms like neurotrophic functions, epigenetic changes, and changes in inflammation. So this is a very exciting time, perhaps some kind of tipping point in the advance in the field where ketamine is just one of many examples of novel treatments that will be coming up to the future. So I'm going to close with a case vignette of someone who had treatment-resistant symptoms of depression and then got treated with ketamine, if we can activate it. If we can have the sound up on it too.
Had a combination of different styles of therapy as well as different medications, and my functioning was pretty high, but I tended to still really struggle with these feelings of just profound aloneness and despair. And about 3 years ago, I kind of slipped into what I would consider a very severe depression. I'm receiving intravenous ketamine, and the day after I received my first treatment, I felt like myself. But what was strange was it was like immediate. The next day I woke up and I felt I could internalize good things about myself. I could feel positive feelings. I could feel feelings in general. The gratitude I have for this treatment. And so thankful I live in an area where there's such innovation happening. I didn't even know this was possible.
Thank you, John. It's good to end on a positive note. Now, Bia.
All right.